Starting now, we will be bringing forward to our viewers insights and comments from leading non-profit executives and persons on the ongoing efforts and needs of the non-profit and the role of all us South Asian Americans in helping bring more support as the world grapples with the coronavirus pandemic. Let's take a look at our Skype conversation with Director of Nonprofit Vibha, New Jersey, Mr. Keyur Shah, who joined us via Skype detailing all the conditions of the underserved communities and their ongoing efforts. Since its inception in 1991, Vibha supports over more than 250 projects in India and 10 projects in the US. As a result, Vibha has now been able to reach and provide opportunities for over 2 million children in need. Joining us via Skype all the way from New Jersey, we have with us Keyur Shah. He is the director for Vibha. Thank you so much for joining us, Keyur.
Hi, Aditi. How are you?
Great, Keyur. Thank you so much for joining us at this time. We are discussing COVID-19 and its great impact on many entities, institutions, and how can we forget our non-for-profit organizations, especially the Indian American ones that are really serving millions of children in India and here. Keyur, my question to you is, right now we are hearing about these massive travel restrictions, curfews. We're talking about a state of quarantine in many countries, including India and the US. What is happening with Vibha's programs right now, and especially, how has this pandemic impacted the lives of these children from your charity?
So, as you are aware, Aditi, Vibha is a non-profit, a completely 100% volunteer non-profit based in US.
Right.
And our official mission is to ensure that every child gets his or her right to education, health, and opportunity.
Right.
Current times are, as you are aware, have been quite difficult. And Vibha serves the underprivileged community, so the underprivileged children. And some of our children have shelter, some don't.
Right.
So our challenges vary depending upon where they live. So our first thought process has been to educate the children and their parents to take care, be safe, not go out, and
Right.
have a little bit more thought towards personal hygiene. But this applies more towards children who have accommodation. We also have children who are on the streets, and they just don't have anywhere to go to except sleeping on the streets or railway stations or warehouses. And that's where our bigger challenge lies.
Right.
But what we have done with them is, we realize that the biggest thing for them right now, more than education, is food and nutrition.
Correct.
So our staff has been very proactive. And in fact, I did send you some pictures today. They have really taken it on themselves, being very compassionate. They have gone out. We have identified a few areas where we have been able to give food. So, kids are aware where to come, and, we go and deliver it. And that's how we have been kind of, trying to make the best out of it with the current situation.
But Keyur, we are talking about, I believe Vibha serves almost 2 million children in India. That's been, over the 250 projects you've had going since its inception in 1991. In that terms, when you're looking at, above 1 million children that you're serving on a daily basis, have the programs sort of halted in certain areas? How are the centers sort of, dealing with the situations right now? And what kind of are the concerns of the students that you keep on hearing about here?
So, Aditi, Vibha in Sanskrit means a ray of hope,
Right.
Ray of light actually, and we want to be the ray of hope for these children. Most of the schools have been shut down since March 15th.
Right.
And we have been told that they are not going to open at least till April 15th. So, it's been you can say a spring break for them for about 4 weeks at least. That's what we know of right now.
Right.
And all that we have done is we have just told them to go home. We've given them some small workbooks and things like that so that they can keep working on their own. And, we have kind of taken education on the back seat right now a little bit. and just focusing more on their health and safety.
Hmm.
Interestingly, the communities that we serve uh, are like, to give you an example, right? A fourth
Right.
grade student would be at a level of second grade at times when we,
Yes.
get them into our program.
Because they're
So we
underserved, so
have,
you're still sort of bringing them up to speed.
yeah, so we have a lot of fast track programs.
Right.
And so we feel confident that, even if the schools start on April 15th or even if a little bit later, we can use the summertime to kind of get them up to speed.
Are the children upset or worried? Have you interacted with some of your centers back in India? What is the feedback that you are getting personally from your, Vibha partners in India?
Children are children. Like my daughter is home right now,
Yeah.
and she's very happy about it. And it's the same for them. They just feel that this is a break. They are not in any panic. They are
Yes.
not in any rush to study, and just having fun. So that's what it has been.
I want to address a little bit more on the children, Keyur. When we're talking about especially Vibha's underserved communities in India, we're talking about some of the most underserved children, such as the one that are living on the streets of India or in the slums in Mumbai and other parts of the country that, your organization is helping on a daily basis. My question to you is, right now, when public health safety is the biggest crisis, in a country of 1.3 billion individuals living, with your nonprofit catering to the most underserved communities, are you concerned about their health and safety? And also, if a child gets sick right now, in amongst all of this crisis, what are some of the steps that Vibha is providing for them?
So, as you mentioned,
Yes.
we are based pan India, at least in 12 states right now,
Right.
and different communities have different issues. Some can deal with it much better than the others. You touched, the street children project, or that we are taking care of, and that's been like one of the more challenging ones because
Right.
they don't have shelter. So what we have done for them especially is we have proactively got some smart cards for them. And this happened because of an incident that had happened a couple of years back when a few children got chickenpox. So now all the children enrolled in our program have smart cards of Reliance Foundation Hospital.
Okay.
So they can just go on their own and they'll be provided services and whatever prescription medicine, whatever they need, and they won't be charged at all.